You want me to go ahead and start?
Let's just start. You can share them too if you want.
Okay. So good afternoon. We have a hard challenge of being here after lunch, but this is a nice challenge because I'm so excited to share this opportunity with these three beautiful people here and the work that they have done and they are doing, and to share it with all of you as well. So without ado, we're going to go ahead and get right started, okay, right into this. So the first, I have a series of a few questions I will ask the panel, and they will say their name and their organization so you know who is with what organization they represent. And then over the course of the questions, you'll get to know them and their organizations they represent and how they came to do this work that they have done. And we'll have a portion at the end for some audience questions as well. So without further ado, let's get started, okay? So the first question on the table is, what work do you do and why do you do it? So let's get started first with Veronica Reed, who's right here on my right. Wave your hand, Veronica, the founder of Resilience Nation of Richmond.
Thank you guys for having me here. I am originally from Chile, South America, so I'll probably talk a little fast, all right? Because I'm excited to be here and you all look awesome. So I am the founder and executive director of Resilient Nation, La Nación Resiliente. It's a non-profit. I have done this work since I came to the United States. I came here, didn't talk any Spanish at all. And here I am 20 years later, still believing we can make a difference. So what I do is basically close the gap. I'm invested in empowering the immigrant community and in doing a lot of advocacy, because I don't know if you all know, but we have a lot of work to do in our community. So closing the gap and mostly invested in mental health and opportunities for positive role model and to really overcome the invisible barriers that we all are aware of but are difficult to jump over for our most vulnerable communities. Hope I answered. And why I do it? Because I'm incredibly naive and I actually that we can build a better world.
Thank you, Veronica. Nisi Hill, who is with the manager with the Social Determinants of Health with Community Cares and Better Health.
Thank you. Good afternoon, everybody. I'm so excited to be here as well. Again, my name is Nisi Hill. I work at Aetna, but I help Virginia, and I serve as the Community Cares Manager for the team. So it's a mighty team of two, so myself and I have a community strategist. She lives in Charlottesville, Virginia, so we cover the entire state of Virginia. I look at data around social determinants of health. So we have an internal system where we can see all the localities for the state of Virginia, and it gives us all the information and data around what's going on around the state. And from that information, we strategically come up with the localities that we want to focus on. Generally, those localities that have two or more social determinants of health of like a 50%. For example, if a locality has food insecurity, or they need help with SNAP or transportation issues, or different things like that. So we look at that data and we use that data to determine what organizations we want to partner with around the state. So I'll give you that background. So we are boots on the ground. So the community strategist, throughout the year, she probably attends about over 200 meetings with community-based organizations, and I also attend meetings in the community as well, again, working directly with community partners, addressing directly what's going on with people with lived experience. So those organizations, again, that touch the people that we're trying to come in contact with to impact, to make differences and health equity within the communities. I do the work that I do because I love people. I have a background in doing this type of work for about 10, 15 years. I worked for a lot of different organizations, and it's something that I'm really, really passionate about. I've also worked in VCU in the past as well. At the Center on Society and Health as their community engagement coordinator for about 3 years. And again, I'm passionate about seeing, changes and health outcomes within our communities and seeing just people do better. So thank you so much.
Thank you, Nisi.
You're welcome.
Next, we'll hear from Katina Brake, founder, Mind Over Matter Legacy.
Good afternoon. Good afternoon, everyone. As stated, I am Katina Brake, the founder and CEO of Mind Over Matter Legacy Consultants. My business was birthed basically off of my lived experiences. I owe the responsibility to be in the community and educating in the community about the things that people like you talk about every day that the community never even heard of, such as social determinants of health, mental health awareness and advocacy, holistic healing practices, trauma-informed care, and resiliency. And why do I do it? Lived experiences is a calling that is upon me, and honestly, I have no other choice, and I love doing it.
Thank you. Our next question, what about your work inspires you? So I'll let it sit there and linger a minute, and I'll repeat it. What about your work inspires you? Who would like to take that question first?
I'll follow up. The ability that I have to connect with people. I love people. I can meet you at Target and start a conversation with you. Also, understanding people and where they come from, meeting them where they are, being able to be impactful genuinely. That's what inspires me.
Thank you. Veronica, would you like to go next?
There is a lot that inspires me. I have a heart for the underdogs. I have been an underdog myself. I'm an underdog in many ways, and we all are underdogs in many ways. So it inspires me to truly empower people that would never accomplish very simple goals unless I would have helped them. It's invisible. I support people, like I get calls when there are shootings here in Richmond, those things that don't come in the news. When people their immigrants coming here, they don't have anywhere to sleep. I have for years worked with the homeless community, so we live in a beautiful place that has a lot of gaps. So when we add that to the immigrant community, where there are undocumented people that don't have access to healthcare or transportation, the agencies tend to believe that it's a barrier related to language, and language is the last barrier that matters. People will have 200 barriers before that, and one of the biggest is lack of trust. Also, experiences that will prevent them from asking for help. We also have lawyers that are telling our community not to seek for help because that can impact their immigration status. So the multiplication of adverse child experiences, if we want to put it in a simple way, multiply by 200 when we're talking about the undocumented community. So I just can't do anything but do what I can, and at times there are days that are difficult because somebody got shot or died and they don't know what to do with their body and they're scared to ask for help. But when we make a difference, we know the difference. There's people have been graduated that they don't even talk Spanish. They come from Guatemala. They speak a native language, so it's the third language, or they are all immigrant together, and we are an amazing community. But when I can make a difference and I see that somebody graduated, that somebody has shoes, that somebody is willing to, I have people to enter a building and seek help, or to help them to imagine the world, is amazing.
Thank you. Lucy?
All right. A lot about this work inspires me as well. Really, the most inspiring thing for me is just seeing people just be their healthiest self. So that's what I do on a day-to-day basis, just addressing those social determinants of health. So, for instance, I'll give you an example of a project that I'm currently working on right now with the American Heart Association. We started it's called Heart to Heart, and it's in conjunction with the barbershop in Petersburg called Another Level Beauty and Barbershop, where we actually train their cosmetology students on how to take blood pressure readings for the clients coming into the shop. So we did a training with them and gave them data around the numbers of those that have high blood pressure in the Petersburg region. And so when they're coming in now, the students are coming in taking their own blood pressure, also taking people that are coming in for appointments, and they also have people coming in from the community. The word has gotten out that, hey, if you need your blood pressure read, and we train them on what the numbers mean and all that. So that's something that really inspires me, as well as them, taking that ownership of their health and just, spreading the word to friends, family, and clients, and just trying to improve health outcomes for everyone. So that's really inspiring to me to kind of see what a collaborative impact can do together.
Thank you.
You're welcome.
So our next question, what barriers do you see when you are out there every day? Now, I know you all are out there in the community doing amazing things, just amazing things with your organizations from your passion. So what barriers do you see when you're out there every day? If you could maybe elaborate on like the top 2 or 3, because I know you see many. Yeah.
Yes, great question, thank you. I think the biggest barriers are the invisible barriers. We really need to rethink about how we approach the underdogs, the disenfranchised communities. We really need to rethink about our own limitations and our own capacities. We are all human, we have all needs, and we have more in common that, people think about South of Richmond, that's like, like Nigeria over there, and then there is maybe Mexico over there, and then it's South of Richmond. I will tell you all that we're all in like Mexico and Canada and the United States, we're all North America, and Richmond is, people think that Chesterfield and Henrico, they're just a different type of people, the people that have never like crossed a bridge to go from one part of the city to another. And I think that we can't blame them for having choices. It is beautiful to have choices. But what I think are the barriers is that people truly struggle to measure, they are measurable. We live in a world that requires a lot of data. And to give one example, because this is a very broad, I have so many barriers, but I'll pause in one. We all know that we have issues with violence in our community. I think we all are in agreement with that, right? We kind of are in agreement, right? But when I have, for instance, address this from a very practical aspect, I want to address addiction and violence in very clear ways. The agencies that have the funds, they tell me we don't have data. And I struggle with that because we do have data. There is national data, there is data that's not even in the news, because when I will just be very direct. There's a lot of shootings that are not even reported here. There is a lot of good work that's going on, but our community, there are people, young kids that are dying and nobody knows about it. And so the families will call me because they don't know what to do with it. And so I help them from the mental health. They have my number like for the last 10 years. But I am one person I can't even try to get this undertaking of an issue. But the biggest barrier is that we live in a world where we make assumptions about others, and we also distribute our funds according to those preconceived ideas. And while data is important, we cannot prevent from funding real social issues because we don't have data, because the data is there. We do know that people are dying. We just need to go beyond the data, because the agencies consistently go to South of Richmond and they ask, what do you need? People are sick of surveys. Nobody wants to do, I'm sorry, but I hate surveys. Don't survey, please, all right? Because it's, maybe a necessary tool, but it doesn't work for the immigrant community. The immigrant community is not going to participate in the surveys put out by the cities or the agencies. And so a big part of the community consistently, and not intentionally, gets out. It's not included in even, not even the decision-making process, but I'm talking about the delivery process, okay? So the barrier is to understand that we have to really meet people where they are. We just don't have to talk about it anymore, we just have to action it out. Because we have been there is power in all the investigation, and I want to I believe in all PhD, you guys are awesome. I believe in education, love education. But when we want to make a difference, we definitely need to have our feet in the ground, be open, to be flexible, and truly trust in the people that are doing the work. Trust and love is the one way I can guarantee you is going to solve all our issues.
Thank you.
My top barrier for people is housing. Housing is the top barrier, and also safe housing. And not just from a balance standpoint, safe housing that is molded, floor to ceiling, pushed in, decayed, rodents, and just safe housing in that nature. Slumlords with no laws to protect our residents. Mental health struggles for people. I could go down so many limbs and branches about social determinants of health, but it all comes back around to your mental health, how you process things, your emotions, what you're faced with. When somebody else may think you could do better, or they should be doing better. When you're really just stuck in survival mode, and that's the only mode you've ever known to be in. It's almost like a comfort zone. Also,
If you have more, please.
the lack of knowledge as well, the lack of knowledge of many resources that already exist that people don't know about. And then the lack of trust for the organization that provides the resources. And our community owns that because of how long and how many times they have been taken advantage of. And so trust is a huge issue. Addressing the barriers?
Yeah, if you have if anyone on the panel has other barriers that they thought of since we started answering this question. Pardon? Okay, right, that's probably our next question. You're following.
Yes, I love that. I was going to also talk about the housing issue, safe housing and affordable housing as well. That's something that I see a lot and also hear a lot as well. I do a lot of work in the Tri-Cities area, like Petersburg, Hopewell, and they don't have a lot of housing options for those that are unhoused. So a lot of times I'm calling to different organizations or shelters like in Richmond trying to get people, but how is someone from the Tri-Cities going to get over to Richmond if they don't have housing? So that's definitely a big barrier that I hear in the community, and also for a lot of the members, Aetna members that I hear from working with, we have community health workers at Aetna that I partner with a lot internally, and also care managers, so I work with them to also get like a beat of what's going on as well in the community. So yes, housing, also I have mental health written as well. And another thing that I see a lot of is a lack of access to healthy food and nutritious food. So I sit on the Food is Medicine Coalition to the Virginia Federation of Food Banks. So we're working to just address some of those issues that families are having with like having access to food. that they need. So it's another big barrier.
That is a huge barrier. That's an area of my scholarship is food, medicine, nutrition security that we work with our mobile health and wellness program here out of BCU School of Nursing, as well as when we speak to all those access with areas pertaining to the social determinants of health. We are over in Southwood Community on Fridays. And Thursdays we're in Tappahannock, which is more of our rural population. And Tuesdays we are down in the Lawrenceville, South Hill area. And Wednesdays we are in the Petersburg area with mental health access and nutrition.
Beautiful work you guys are doing there. Yes. One of the issues that we didn't mention, but there are many, but lack of transportation. I mean, people have to decide if they go to pick up the food, or it takes effort. The bus transportation is really awful. I encourage anybody to take a bus and wait for the bus in the side of Richmond that after one part, it doesn't have any protection. The buses come sometimes not even every 10 minutes, every 30 or 45 minutes, sometimes more than an hour. So if you want to go from Petersburg to Henrico, please help me out, you guys. There is no one line. Transportation is a huge problem that prevents people from accessing food and shelter. And on top of that, we're talking about housing, and I want to be fair with everyone, but we know that the immigrant community, especially undocumented community, not only Hispanic, but in general, they live in the black market. So there is unfortunately even further risk to be taken advantage of because the people are not aware that they have rights, they can speak up, or they can even exist as a human being. So just what you guys, every time that we acknowledge that you're in front of a human being, we are doing something already.
So this leads us to the strategies or efforts. What strategies or efforts have you seen that best address those barriers? It's interesting when you were speaking of transportation because I don't know how to say it, but just to say it, we thought we were doing something with free, with you can ride a bus for free, right?
Yeah.
We thought.
I'm sorry, I'm not picking on anyone or anything, but we really thought, oh, this is a great solution to maintain this post-COVID. But Veronica, you just had a great point. You want to go to Petersburg, your sovereignty and your mobility, your sovereignty into going to pick up or apply for feed or box or employment. So I just use that as an example, and I'll give you all a few minutes to think about it. But what are the strategies or efforts have you seen that best address those barriers? I mean, if you only come up with one each, that's something to start with the conversation, and we can continue it. Or have you seen any strategies or efforts? Let's go there. We're open here. This is what this is about. Go ahead.
I actually have seen
Good.
things being addressed. Of course, improvement is a great thing for everything. For instance, when you said about the transportation with the bus, there are areas where it don't go as far, and you have to think about your seniors, you have to think about your parents with more than one child, or just a single individual that have to walk down a dark path once the bus let them off at the last stop. Shelters, and the time that they have to be there. But addressing areas, I've seen the funding of grassroots organizations and CHW, which are community health workers, positions. Community health workers have always existed, and we always will. It is a passionate person that cares about the next. And much more, but I'm gonna flow. I feel as though some or most government-funded organizations look from the top down. And grassroots organizations and community health workers look from the bottom up within the people. And that's the difference. Job trainings, workforce development, partnership with food banks. The most important things are that grassroots organizations, they nurture, they listen. Grassroots organizations and community health workers. They nurture, they listen, they understand, they empower people, and they love on them from a genuine place. And we do understand that everyone is not able to do that in their line of work, and that's a reason why I advocate for community health workers and grassroots organizations, because we are developed to do those things, because that's what's needed in our community. So much has taken place for so long, as I've already spoken of the survival mode, until even people that look like us, we feel as though we can't trust. And so showing that and showing up constantly to show that we care, it builds the trust within the community. And that's where the impact starts, and the community can start to trust those people that shows that, and we can move them up the ladder versus the hamster wheel.
Come together, let's apply for these grants together. Let's come together and see how we can help the community together, because we again have the same common goal, and let's work collaboratively. So that's one of the strategies that I think work the best to address some of these barriers, is that. And
Missy, I'm sorry to interrupt, but can you, I just want to have a moment of pause. Can you repeat that? Collaboration
over competition.
Yeah. Okay, let's have a moment of silence. Yes. Collaboration over competition.
It's not a competition. So for me, it isn't. Even though I work at an MCO, managed care organization at Aetna, but I'm still, willing to, I'm partnered, we partner with everybody. So that's one thing I will say. Another thing that I've seen work within the work that I do is that we try to establish community health councils in different parts of the state. So for example, I mentioned I have a community strategist. She established a community health council in Southwest Virginia, where she gathered about 15 different agencies, and they actually come together and they come up with a solution. So we don't have a part in that. The agencies come together and say, okay, what are some different things that we're seeing? We show them the data of what's going on within the communities and talk about the data. But they say, okay, we want to come together to address this or that. So they are currently in Southwest Virginia working on a transportation solution right now with the United Way and some other partners to address that, because that's a big issue because it's a rural area. So again, that's one thing that I've seen work is collaborative, and then just bringing up agencies to the table and just seeing, where we can make change. So.
Thank you. Veronica?
Sure, I think that we all are human, and we like people to be genuine to us. So we're not discovering the new species over here. Being genuine, as somebody that has worked so long in social field, there are a lot of things that work. We cannot, we are superheroes as it is, but we are faced with some very difficult troubles that we can solve in a second, right? So I think what works is to be genuine and to be honest. If we're gonna go to the community, do the survey, remember we have to follow through with actions, okay? Surveys are only efficient if we are gonna build trust with some follow-up that is measurable in a time that's less than 3 months, please. If we are asking, because people do approach me I'm not that popular, but people often say, hey, I want to do something with the Hispanic community, and they really want me there, but then they don't really care to the delivery parts. You don't get to use my name for that, but there is a temptation sometimes, or maybe for our own human limitation. I don't want to disregard the beauty of all the nonprofits that do awesome job, because we are human. But just simple things really work. I also want to, maybe to you, I want to take a moment to thank Mary and friends. Very simple. We had a game night, and when I asked them, I need transportation. I need you guys to give me a bus. The people from South of Richmond are not coming here. Okay, there's no bus. Nobody's gonna come here to come to a game night. And we have the transportation, a simple bus. And those people are never being downtown. Those people are never being even here of SU, came to a family night in a very simple and humble way. It was me and myself, and I recruited my son, a few other people, but the power of us is immense. There are people that are in a building where they feel they have dignity, they have respect, they have access to feel human again. Those things work. So we don't have to reinvent everything. We don't expect any of us is in a capacity to solve these huge social issues. But every time we move 1%, the sky's the limit for all of us. So let's be 1% more flexible, 1% more empathy, 1% more even self-care, 1% of having genuineness, 1% of kindness. The sky is the limit, and that never fails. Never, never, and never will. So we are all human, and we have immense power to impact ourselves. We are in a world that is not perfect, but every time we choose to be 1% above, 1% of kindness, love, acceptance, dignity, and respect, we're doing awesome.
Thank you. So, I have a couple more questions, then we're going to open it up, okay? But you see me up here with my notes, taking notes and stuff like this. We've heard about how the importance of the intersection between data and lived experience, and the ability to connect with people. And how the impact of the work that we do. And I've heard you, Veronica, used the term underdog. I like to think overcomers, the empowerment piece, and how we can fill the gaps that exist. And sometimes we become engaged in this work without knowing the invisible barriers, the roadblocks, because I love the Amazing Grace, the roadblocks. And most importantly, the collaboration over competition. I have the saying, there's enough food at the table to eat for everyone to eat. And then we've heard of the roles of community health workers. What was it, maybe a couple of years ago, as we were emerging from COVID-19, I kind of sort of feel like the role of the community health worker was emerging. And now we're 5 years from the maybe peak of the pandemic, but we've incorporated that quote-unquote lesson learned regarding their significance and moving that role to a certified community health worker through certification. So now I'm circling to, if you could do anything tomorrow that would make a difference, what would you do? So I'm gonna let that sit there. If you could do anything tomorrow that would make a difference, what would you do? And when we thought of this question originally, I remember we had a conversation regarding, well, should we put a monetary limit on it? Should we put something around it or frame it? No, we're just gonna leave it out there, okay? If you could do anything tomorrow that would make a difference, what would you do?
I don't even need my notes for this one. I did have a few top, but I will be obedient and do my top, which is affordable housing. Affordable housing, so what I would do is I would implement and make it mandatory that every housing construction site that is being built up will be mandatory for them to divide 50% into based on income affordable housing, every single construction site.
So, yeah, I just want to follow up with you. There was I'm sorry, what's your name? You did the pitch from DMV?
Oh, me.
Yes. Take two. I'm sorry, what's your name again?
Take two up.
Take two. So I lived in Washington, D.C. for about 20 years. I think I worked there. So. And part of the issue in like Montgomery County, Maryland, is kind of known for from the housing perspective that they have set aside a certain percentage of housing or construction that is income-based housing, whatever new, if it's a new housing, like ownership, that there are like maybe a townhomes, a certain amount of townhomes or et cetera, that are at an affordable, what they deem set aside as an affordable percentage based upon, I believe, HUD. I'm not a housing expert, but that's the way one of my friends told me this was the word. So what Katina is proposing, what she speaks about is also related to the privatization, we called it in DC, the privatization of HUD.
Yeah.
Where you, all of a sudden, I mean, only one way to say it, but to say it, when we had, I tell the students with public housing, a lot of public housing in Richmond, just throughout the nation, it was built anywhere from like the 1940s to the 1960s. And it is not a model where revenue and, yeah, I'm saying, and revenue, where it's a system where you look at your revenue and your expenses and you're making profits, so you could put money back into this and say, how we're going to repair the windows, we're going to replace windows, we're going to replace doors, etc. It isn't that model. So you have people who are existing, living in environments where you have, what is that, the cornerstone brick, like cement, housing, limited windows or windows that may not be insulated, they be open to rodents, and infestation, etc. The environment, the location, and I'll take what is that, is it Creighton Court? It's across the street from the large cemetery?
Yes.
Okay. And then you know, because of redlining, you have like always, and I shouldn't say always, but disproportionately increased number of public housing developments in one geographical part of an area. When I lived in DC, it was in Southeast, which was also had a river that went through DC to limit access because you needed a bridge to cross to the other side. Where we are here in Richmond, we're speaking of like East End or now South Side because you need the bridge to access across the James River. And disproportionate, I think there are about 4 public housing communities in the 23222 zip code. And I'll bring up zip code because, quote unquote, we know zip. When I say we know how zip codes have been utilized to further disparity, etc., with services and education, etc. And Sherry's told me I gotta be quiet. This is 5 minutes. So I say all of that to say, Katina, you're not too far off. You're not far off at all. So back to Nisi, back to Veronica, and because I want them to finish out this question, what is missing? I'm sorry, if you could do anything tomorrow that would make a difference, what would you do?
Sure. I think that we have a lot of resources. We need to maximize our resources. All of you are a resource. So I feel like there are simple things we can do to maximize those resources. First of all, simply, please, when we have a project, whatever project it is, that is truly meant to empower the community, if we want to have a position for every grant program, just ensure we have the same amount of money to deliver the program that is meant for the people that we say it's for. That we have navigators, okay? Also want to give a shout out to the community health workers La Casa La Salud that are doing job 100% in Spanish. I helped to certify them in 2017, I think, I don't remember. But I think there's just a lot we can do. And when we have any funds, we don't have to create new things. We have funds, there are funds. When we have those funds, ensure that those funds don't only go to just pay for the person that needs to manage it, unless it's somebody that is invested in the communities, embedded in the community, and we know for sure that the people that this program is meant to are actually benefited from the program. That's not that difficult, but looking at the reality in Richmond, it seems almost that we forget that. So we are saying we want to empower the South Richmond. Well, let's really work with the neighbors that live there and ensure that the program that says this is meant for those people, those families are actually impacted in a positive way with that program. The other simple things we can do is, and please invest not in the front end, invest in the back end. Whatever you start, but I mean that our programs are really impactful. And I struggle to say impact because I live in the area where I want to empower people, and my work is completely invisible. If somebody graduates only because I told them something and it was, like I said, it's invisible. So we want to shift our thinking and truly give kudos to those people that have lived experience, and to put them in a space where they can empower or advocate and change policies. We can change policies maybe long term, but there are a lot of models that work really well. I'm very familiar with what works in Germany. We might not have that mindset, but we have a lot of resources. We are not defeated, and I think just keeping that hope is helpful. But in a perfect world, I would love to see addiction recovery and mental health for the immigrant community, because let's say it, we live in a complicated world, and if we don't do it now, we know there's going to be more shootings and more death and more tragedy. So we are at the verge of a very big shift in the communities, very polarized, and we can do a lot of stuff. We can shift our thinking, be open, and continue to support truly the people that are living in hardship, whether that's whatever in any way.
Thank you, Veronica. Nisi, do you have anything what would you like to have?
As far as you said, what would I do tomorrow to change?
Yes. To make a difference.
I would actually dismantle systemic racism. That's what I would do, because a lot of the things that we are talking about, it's a deeply rooted issue. So I've been doing this work for a long time, as a lot of you all may have been doing as well. So that's the main thing, is systemic racism. So all the policies, the housing, the food, insecurity, it's all, that's what it is. So that's the root of it. So continuing to have these conversations and to come together and to actually just addressing, really the root of what's going on. And I have a background in policy as well. I have an MPA, so I've worked at the General Assembly before. So actually going and talking to your legislators and civic engagement is something that I strongly stand behind. So just on a state and local level, just knowing who your representatives are, talking to your neighbors. The election is coming up. Please vote if you're, I worked at the Department of Elections before I had this position where I'm at Aetna. So definitely, again, if you're eligible to vote, encourage people to go out to vote, because a lot of these people are making decisions about what's happening sometimes in these communities as well. So that's all I got to say. Yeah. Thank you.
I think on the schedule it says 1:45 to 2. There's a break. Yes.
This question is for, this question is. Hello, okay. Can y'all hear me?
Yeah.
This question is for Niecy Hill. So you mentioned that you have access, I guess, to geographical maps where you can see where the social drivers of health are elevated, and where there's two or more, that's where you guys want to step in and discuss strategy. So first question, who decides the approach? And who do you partner with, or who do you decide, where's the decision made as to who we should be partnering with to address this issue? And who funds the initiative?
Thank you, that's a great question. So, as far as the approach, I have a supervisor, she supervises our community cares team, so I get with her and my community strategist and we look at the data, and again, generally sometimes we pick the top 10, so my community strategist and I, we split up the state, so for instance, she has about 35 localities or 40 that she is focusing on, and I have about 25 in the state from that information. And then from there, we do research. So if I know of organizations in a certain area that do certain things, so for example, if I see in a certain area that there's a high, need for, food insecurity or health literacy or lack of access to certain things, I'll look at organizations and just schedule meetings. That's generally how I do my work, and have conversations with them, with the staff, and see, hey, this is what the data is showing, and this is what we're trying to do in the community around addressing these social determinants of health. What are you seeing? What are your, the people that you're reaching in the community? Can we talk to, your clients? Can we come in and, learn? So that's generally what we do, and then from there, we work together. I work with organizations to determine the approach as far as, okay, what are you currently doing? How can we partner and possibly help in this? And if they don't have an initiative going on, I might connect them with other people. I consider myself a connector as well. So even if we can't come in and provide funding for what's going on, there might be another agency that they can partner with that's trying to do the same thing and apply for grants, etc. We do sometimes have a bucket of money for community investments. And this year we identified 10 agencies throughout the state that we gave money to. So that's generally how it works. Hopefully I answered your question.
Yeah, and we can connect there.
Okay. You're welcome.
So I was just informed we do have time for about approximately 2 more questions. If there are any more questions? Yes. Yes.
I would like to go back to something you said about the survey.
If you can speak up, please. I think someone's coming to you with the microphone. Thank you.
I would like to talk a little bit about the surveys, because in my office we do a lot of surveying. Richmond Connects has been our brainchild and fully now a part of the city's community engagement profile. So what is the alternative to surveys? Because we have to have some type of statistics, but are there any other alternatives?
I think it's a great question. I think there are alternatives, but more important to me, more important than the survey itself, is to truly ensure that we connect with the community in a meaningful manner. We have to talk the language. We have to make it feasible. Like for instance, I supported an initiative recently with Hopewell and another with Chesterfield, and also indirectly with Richmond. Basically, there is nothing wrong with data. I want to be very clear that data is relevant, all right? But the way we deliver it is incredibly important. The how is important. There was a survey that last year it had like 10 different pages. And there was like, who has time for that? None of us have time for that. So, not the questions also at times are really, the person that did it understand what you want to do, but if you're not, they don't have a clue what you're trying to do with the question. So there are trust issues, but we are multiplying those trust issues, because if you go to specifically the undocumented community, they're not going to participate in your survey. And I'm not saying it is your fault, but in order to close that gap, We have to work with people that are in the ground, the trust builders, the connectors, your superheroes, your all of us here that do work in the community, and that we are the quiet leaders, not the servant leaders, the churches, the people that get the calls at night when there are shootings, when there are immigrants, when there are problems, and probably many of you. Those are your helpers. That in order to do it efficiently, it is simply as including the people that you want to be included. Be mindful, there is a part here in Richmond, in any city, we have people that are adults and not necessarily all undocumented people or immigrants, they don't read or write. So how are we going to be inclusive? It's not one solution, but it's the sum of them. If you do 1% flexibility and make your survey in a way that's meaningful, and you can tie it up like, I'm doing the survey because this might be a road in 5 years, or tie it up to something that's visible and that they can connect. We have blended families. Mom might be undocumented, dad is in the process, the kids are American citizens. Those kids were going to vote. Those kids are playing key roles, they're continuously translating and cannot go to school and have extra layers of barriers that they are responsible to answer the question. I hope I'm getting to the point, is to truly meet people where they are and to work closely with them, to make it meaningful to them and to build trust. And when we do a survey, ensure that it makes sense to them. That if you make, before, we need to invest in the front end and the back end. And I have helped make surveys because the questions themselves need to make sense. If you are just doing a survey and we only keep it in the theoretical level, we'll miss it. We need to work collaboratively. Did that answer?
I want to add to what you're saying, Veronica. Part of what we do with community-based engaged research and community engagement is we have what we call the end user or representatives from the community involved in the beginning. So I think what you're speaking with, Veronica, what would enhance and to your question is to have people at the table, the respondents who you want to complete the survey, the population that you're looking for to complete the survey, to solicit the responses, their opinion, have them involved in the very beginning when the survey is constructed. Have them at that table. It's about empowerment. It can incorporate, I'm coming to their lived experience, etc. Everything that we've said. And then once you have tabulated the results, you look at taking it back to and saying, this is what the results of the survey. We recently had with our Global Health and Wellness Program, we had what we call an advisory council meeting at the Health Hub. And we, before COVID, apparently we were having about 4 a year. And then we've had to kind of get back into our rhythm. And so this was only the second one that we've had of this calendar year. But we spoke about our programs that we were running, like the prescription produce program, we have a brain health initiative program, and we asked our council members, what are some of the things that you all want to see us look at? What is on your mind? What is your opinion? These are some changes we're looking at with our consent form. What is your point about this? What are some things in general? One gentleman said he wanted to see more done, more meetings. So I say there's the power in that of engaging people from the community that you're looking at serving from at the very ground initial level of that development of those surveys, and as well as the analysis of those of the surveys and responses and programs that you may want, or solutions that you may wish to create from that to evaluate the effectiveness.
I want to say something really quickly to that. We were distributing food in South Richmond, and we need data. So we were using precisely to do the surveys, but instead of asking people's names and all information, the undocumented community is scared to give you their exact name and their exact age and etc. There is a huge fear factor.
So
right?
you're starting off on the wrong foot.
Yeah.
That's right. So what we did, in order to have the data, we kept it very quick, very simple, because I could be a superhero over there. So instead of putting people at a stress level, we put them down and say, hey, we want to continue this effort. How many people live in your house? 3, and give me your zip code, and do it in a way that the people that are impacted are not threatened by it. Because especially when we're talking about working with the undocumented community, and let's be clear, and the Black community and the oppressed communities right here in Richmond, we have a history of very bad things that happen when people give their data, right? So when it's coming about health issues, it's hard to trust, but we are closing the gap in the way that we are doing it, including the people that we want to work with. And that is your equation right there.
So I'm taking away a cultural sensitive
Yes.
service.
Correct.
Yes. Yes.
And do it culturally sound, and also include the people, because those people will help you with your survey. And be kind and be open to give gift cards. We ask people for things that it's time. If my time pays, why cannot I pay for the person that did the survey? We are telling people, give people $25 gift cards, because it's an hour. Somebody's trusting you that you're going to use the information correctly. Let's multiply that by, if we give people time, value, I value you as a person, to give you dignity, I give you your time. At least $25 gift cards for everybody that participates. I think it's a fair request.
So this has been wonderful. I want to say thank you to Katina, thank you to Nisi, and thank you, Veronica, and thank you to you all.